health headlines. Alcohol consumption in the U.S. is at a new low, and there are new guidelines for blood pressure treatments and what pediatricians are recommending about COVID shots this fall.
Joining us this morning, Dr. Arjan Venkatesh, Chair of Emergency Medicine at Yale School of Medicine and Yale Medicine. Doctor, great seeing you once again. And this recent poll that found Americans are drinking less alcohol than ever in at least the last 90 years, they're saying, what is possibly behind that trend?
Yeah, Gallup's been doing a survey for 90 years, and this year an all-time low. Only 54% of Americans reported drinking any alcohol at all. And it's really two things, I think. The first is over the last 20 years, people have learned that moderate and even light drinking can be harmful for your health, increases your risk of heart disease and liver disease. And we see it across all ages, all incomes, but where we really see it has been amongst our youth. Those under the age of 35 are increasingly not drinking. They know it's harmful for their health, and so maybe this is another place where we can learn from the kids.
Absolutely. And the American College of Cardiology recently released new guidelines for treating blood pressure concerns. What can you tell us about this?
Yeah, the new guidelines just came out this past week. And what's important and new in them is that for years we have said that if your blood pressure was under 140, that you might need to do a little bit of lifestyle modification, but that you didn't need any medication. The newest guidelines say that if your blood pressure, the systolic, that's the top number, is between 130 and 139, that you should first try some lifestyle modification, lowering the salt in your diet, getting 150 minutes of walking or exercise in every week. But if that doesn't work, that you should start a medication for blood pressure to really reduce your chance of having a heart attack or a stroke. And that's a real aggressive change in how we think about blood pressure and people's health.
Okay. Doctor, the American Academy of Pediatrics making a different recommendation than the CDC when it comes to the COVID vaccine for the fall season. What should all of us, and I guess particularly parents, know about that?
Yeah, I really want to make sure that people don't get confused by the headlines on this one. Since the pandemic, the CDC recommended that any kid over the age of 6 months get a COVID booster shot every year. They've changed that recently to say to have a conversation with your doctor. Those doctors, the pediatricians, the American Academy of Pediatrics guideline that came out, says that if you're above the age of 6 months and under 2 years, you should absolutely get a COVID booster every year. If you're a kid that's got any health problems, asthma, other lung problems, you should absolutely get a COVID booster. And that other kids should still have that conversation with their doctor. It's important to know these vaccines are safe, they're effective, they work. There has not been any signal that says that they're remarkably harmful, and they can help many kids stay out of the hospital.
Good to know. And Doctor, while we have you, of course, it is back to school time. So a lot of kids are making the transition back into the classroom. And sometimes that comes with kids coming home with some new, I guess you could say, colds, germs. What is your best advice to staying safe and healthy this time of year?
Well, one thing to remember is that getting those germs and getting those colds is part of all of our lives. It makes our immune system stronger, but they can be nuisances in many ways, and some of the times they could be, stickier things like flu. Make sure your kids get their shots, wash your hands frequently, and you'll be fine.
Great.
All right. Doctor, thank you very much. Great seeing you as always.
Yep, thank you.
Thank you.